Great. Hopefully everyone can see this first slide, okay. But yeah, please let me know in the chat if you can't see anything or having any trouble hearing. Okay. So yeah, thank you so much everyone for joining this session today. So this is an event on personalised care in secondary care in London. So it will be focusing on specifically personalised care role support for secondary care patients across London. So the aim of this session today is to really showcase where personalised care roles are being used to tackle health inequalities in London and are also having a huge impact on patient care and outcomes. It's also aiming to come together as leaders across London to really explore how we can better collaborate to further this agenda. So you think could everyone just stay on mute if possible? Thank you. And then we're also hoping to further explore as well what we hope to achieve within this space, within secondary care and personalised care. So we will be welcoming Melissa Heitman, a respiratory consultant at UCLH Hospital, to share a bit more about why we should prioritise personalised care in secondary care. We also have an amazing group of speakers who will be presenting specific projects embedding personalised care roles in secondary care in London, specifically supporting cardiac patients, chronic pain patients, and also patients in emergency and discharge departments as well. And then we'll also be welcoming Jane Clegg, Regional Chief Nurse and SRO for Personalisation at NHS England London, to share our 2025 ambition for London. And then we'll also finish with a 25-minute panel discussion to have a broad discussion around personalised care in secondary care, but it will also be an opportunity for you to ask further questions to the project presenters as well. So just briefly before we start, a bit of housekeeping. So we are recording the session today, so if you'd prefer to keep your cameras off during the recording and unless you're speaking, then that's absolutely fine, but up to you. Please do keep yourselves on mute unless you're speaking as well. And if you would like to speak, please just raise your hand or pop any questions in the chat. We'll be checking that throughout the session today. We will be using Slido at a couple points during the meeting today. So Beth, my colleague, has just popped that in the chat. So you can access that via the link there or by using the QR code.
You want copies? I don't know what you're saying.
No, I'm just
sorry.
It's a meeting. I'm not parting.
Please, could you go on mute? Sorry. Whoever that is. Thank you. Perfect. Okay, so I'll just hand over to Mel, who will be sharing a bit more about why we should prioritise personalised care in secondary care, the impact that these personalised care roles can have on tackling key challenges across the system, and also we'll be sharing a bit more practical examples and tips from a real life long COVID clinic example using social prescribing. Thanks, Mel.
Thanks, Molly. It's lovely to be here with you all talking about this really important opportunity for us to support our patients more effectively. My background is as an integrated respiratory consultant, but since 2020, I've led a post-COVID service at UCLH, and I work with the National Long COVID programme at NHSE. And over the last 3 years in caring for people with long COVID, you know, the crucial benefits of bringing broader access to a sort of broader offer of support to better manage a person's wider well-being has really come to light for me. So it's great to see this work taking shape in London and across the country now. We thought on this slide we should start with a reminder of what we mean by a personalised care model. And our focus today within this model is how at secondary care touchpoints we could broaden patient access to personalised care roles to support this agenda. So if we just remind ourselves about this universal personalised care model, this is really a concept where we're thinking about how health and care will be organised in a different way, with a new relationship between patients and healthcare professionals, where patients have a stronger voice, a better, fuller understanding of their condition and of the choices available to them to manage their condition, and where they're better linked to other sources of support in their community. And if you look in the lovely circles underneath, these are the different elements of that model. So starting in the light blue, thinking about shared decision making. I think many of us have accessed some excellent training in growing that skill set as clinicians in supporting patients in those kind of conversations. Thinking about enabling choice, having access to social prescribing, which is that process by which you can link people up to broader support in the community. Growing knowledge, skills and self-confidence through health coaching and supported self-management. You know, there's an ever-growing breadth of offer in terms of how you can support people's understanding about their condition now. And then thinking about developing a person-specific plan, and then thinking about financial elements, so managing their budgets and accessing useful options such as personal health budgets and integrated personal budgets. So those are some of the 6 components, and what we hope through access to that model is that we could achieve some really special benefits, aiming to improve population health, ensure care is better tailored to patients and communities, relieving NHS pressure through bringing in other avenues of support, addressing health inequalities, and even important goals such as reducing excess mortality and emergency admissions. So a lot to potentially gain if we feel, if we do this right, we feel the evidence supports this. So on the next slide, one of the key roles of ensuring better access to personalised care is in supporting people to manage the wider determinants of health. And these are those aspects about a person's life which have a huge impact on their health, either through increasing their risk of long-term conditions or impacting their ability to manage them. And here we're thinking about their educational opportunities, their living conditions or their employment. And we know that these wider determinants are estimated to account for approximately 80% of a person's health outcomes. So personalised care approaches, if we do that well, could be an important resource to try and compensate for those wider elements or overcome them to some extent. And then if we look at the next slide, we don't want to start the new year on a downer, but this is a moment when the need to address these wider determinants of health is greater than ever. NHS pressures are very significant due to backlogs from the pandemic and now industrial action, the cost of living crisis, and of course our ageing population. So widening access to personalised care interventions at more contact points with the NHS could extend their reach and bring extra benefits. So on the next slide, if we think about why should this be a secondary care priority, why are we looking to focus this there? And I think, you know, there's a number of compelling arguments. First of all, some of our most vulnerable and complex patients have large amounts of contact with secondary care, either through our emergency services, through admissions or through outpatient contacts. So we have a captive audience in a sense in hospital. I've learned as a respiratory clinician that admission is a very important moment to try and support someone to quit smoking. And if we could also, during those days where we have a lot of contact with a person, try to bring them access to addressing other important elements of their health and well-being, then that seems a no-brainer, doesn't it? And this could bring benefits for secondary care. If we did this well, we would expect to see reduced admission rates, length of stay, improved patient flow in our acute hospitals. Increasingly, I think we're taking on more responsibility in secondary care in driving early diagnosis in our local populations of long-term conditions. There's a good example of this at the moment in the spirometry programme, where across London a lot of secondary care clinicians are involved in trying to improve the quality and consistency of provision of spirometry within primary care, and we're having to work across the whole system to make sure that people get an accurate diagnosis of asthma and COPD. And I think we want to see this as part of our responsibility within secondary care and our contribution to addressing population health. And of course, in secondary care, we are looking after many people with long-term conditions. Some of those fall within the conventional cardiovascular, respiratory disease, diabetes pot, but there are many, many other long-term conditions which are managed through secondary care, particularly outpatient services. And if we can focus in those pathways on doing everything we can to support the self-management of a person and their long-term condition, then that could bring many benefits. So on the next slide, and this is my my last one, I looked back over the last 3 years just to think about how we'd made progress in bringing personalised care into our long COVID clinic, and what were the useful steps along the way. And I think the first thing was that our MDT team clocked quite early on how important this was for our patients, and we kind of aligned our thinking as a department and as a pathway that this was something that we wanted to do well. We also had the opportunity to work as an integrated care system and build relationships with all the providers working in the pathway, and our ICB supported us to make connections with the voluntary sector, which proved to be extremely useful. Long COVID, obviously, as a new condition, meant that we needed to learn as much about it as quickly as possible. And we developed tools to help us understand our patients' experience of their illness better. And within that, we were able to capture learning about what the impact of their condition was on their wider life and how their wider life affected their ability to manage their illness. And it made me realise that I probably wasn't asking enough questions like that about patients who I saw in other clinics in my respiratory job. So understanding your patient cohort, I think, is a key step. Sometimes the partner organisations you want to work with might be on your doorstep, and sometimes they might be further afield and national groups. And for example, in long COVID, we've had amazing collaborations with the English National Opera, with Scottish Ballet, who've all run free support programmes for people with long COVID. And then we got to work on our doorstep with Voluntary Action Camden, who linked us up with the voluntary sector in NCL. And we got to learn about personalised health budgets, and a very large number of our patients with long COVID are now able to access these, and I've seen the benefit of that really come true. It's occurred to me over the last 3 years that in some ways, when you have a fancy complex treatment to deliver to your patients, your bandwidth for thinking about the other elements of their health is less. In long COVID, we haven't had a medicine to focus on, and therefore I think we've done better at thinking about the broader aspects of their health and giving them access to personalised care and personalised care roles. But in my other clinics, I might be using immune suppression or complicated drugs, which take up a lot of my conversation time. And in a way, we need to think harder in those contexts about how we don't miss a trick on the other things that are important to that person. And then I think for your service, you need to think about what's the right model for accessing personalised care for your patients. Could it be that you'd benefit from having a dedicated social prescriber in the team? That's something that we found extremely helpful. You need to get the geography right there and work out where your patients are coming from and who that social prescriber can refer them on to. We found training for the whole team in personalised care approach is extremely helpful, and it's actually quite new content for a lot of secondary care clinicians. I think primary care have been doing this for a long time, so that was really valuable. I've mentioned about forming the partnerships and building relationships, because what's been most effective for us is where we can implement something and then develop and improve it together. And then increasingly, we've become aware of the integrated neighbourhood teams developing in our ICS, and we're keen that secondary care clinicians can play a rich part in those teams, so that they know where they are and how they can be useful to them. And I think that's something that's going to be a really interesting area for development. And then, of course, you want to monitor your progress. And in long COVID, we've been very focused on monitoring outcomes because it's a new disease to learn about. But this is something that we should be doing broadly. And that will give you information about whether there's equity in access to the support, the enhanced support that you're able to offer, and equity in outcomes as well. So really exciting space, a really rewarding space to work in, and I'm looking forward very much to hearing about everyone else's experiences. So thank you very much. I'll pass back to you, Molly.
Thanks, Mel. Yeah, really great to hear about, I guess, key priorities in secondary care and how personalised care interventions can really help align to those as well as also those practical tips, which I think are really useful from a real life example in the long COVID clinic. So thank you.